Hello friends, you are welcome to another edition of Home Remedy Solutions. This channel is solely for educative purposes. Kindly liaise with your physician where necessary. Today, we would be looking at steps to treat a sore throat. A sore throat is pain, scratchiness or irritation of the throat that often worsens when you swallow. The most common cause of a sore throat, pharyngitis, is a viral infection, such as a cold or the flu. A sore throat caused by a virus resolves on its own. Strep throat, streptococcal infection, a less common type of sore throat caused by bacteria, requires treatment with antibiotics to prevent complications. Other less common causes of sore throat might require more complex treatment. Symptoms. Symptoms of a sore throat can vary depending on the cause. Signs and symptoms might include pain or a scratchy sensation in the throat, pain that worsens with swallowing or talking, difficulty swallowing, sore, swollen glands in your neck or jaw, swollen, red tonsils, white patches or pus on your tonsils, a hoarse or muffled voice. Infections causing a sore throat might result in other signs and symptoms, including fever, cough, runny nose, sneezing, body aches, headache, nausea or vomiting. Causes. Viruses that cause the common cold and the flu also cause most sore throats. Less often, bacterial infections cause sore throats. Viral infections. Viral illnesses that cause a sore throat include common cold, flu, influenza, mononucleosis, measles, chickenpox, croup, a common childhood illness characterized by a harsh barking cough. Bacterial infections. A number of bacterial infections can cause a sore throat. The most common is Streptococcus pyogenes, group A Streptococcus, which causes strep throat. Other causes of a sore throat include allergies. Allergies to pet dander, molds, dust and pollen can cause a sore throat. The problem may be complicated by postnasal drip, which can irritate and inflame the throat. Dryness. Dry indoor air can make your throat feel rough and scratchy. Breathing through your mouth, often because of chronic nasal congestion, also can cause a dry, sore throat. Irritants. Outdoor air pollution and indoor pollution such as tobacco smoke or chemicals can cause a chronic sore throat. Chewing tobacco, drinking alcohol and eating spicy foods also can irritate your throat. Muscle strain. You can strain muscles in your throat by yelling, talking loudly or talking for long periods without rest. Risk factors. Although anyone can get a sore throat, some factors make you more susceptible, including age. Children and teens are most likely to develop sore throats. Children ages 3 to 15 are also more likely to have strep throat, the most common bacterial infection associated with a sore throat. Exposure to tobacco smoke. Smoking and second-hand smoke can irritate the throat. The use of tobacco products also increases the risk of cancers of the mouth, throat and voice box. Allergies. Seasonal allergies or ongoing allergic reactions to dust, molds or pet dander make developing a sore throat more likely. Exposure to chemical irritants. Particles in the air from burning fossil fuels and common household chemicals can cause throat irritation. Chronic or frequent sinus infections. Drainage from your nose can irritate your throat or spread infection. Close quarters. Viral and bacterial infections spread easily anywhere people gather, whether in child care centers, classrooms, offices or airplanes. Weakened immunity. You're more susceptible to infections in general if your resistance is low. Common causes of lowered immunity include HIV, diabetes, treatment with steroids or chemotherapy drugs, stress, fatigue, and poor diet. Prevention. The best way to prevent sore throats is to avoid the germs that cause them and practice good hygiene. Follow these tips and teach your child to do the same. Wash your hands thoroughly and frequently, especially after using the toilet, before eating, and after sneezing or coughing. Avoid sharing food, drinking glasses or utensils. Cough or sneeze into a tissue and throw it away. When necessary, sneeze into your elbow. Use alcohol-based hand sanitizers as an alternative to washing hands when soap and water aren't available. Avoid touching public phones or drinking fountains with your mouth. Regularly clean telephones, TV remotes and computer keyboards with sanitizing cleanser. When you travel, clean phones and remotes in your hotel room. Avoid close contact with people who are sick. Treatment: a sore throat caused by a viral infection usually lasts 5 to 7 days and doesn't require medical treatment. To ease pain and fever, many people turn to acetaminophen, Tylenol, or other mild pain relievers. Consider giving your child over-the-counter pain medications designed for infants or children, such as acetaminophen, children's Tylenol, Fever All, or ibuprofen, children's Advil, children's Motrin, to ease symptoms. Never give aspirin to children or teenagers because it has been linked to Reyes syndrome, a rare but potentially life-threatening condition that causes swelling in the liver and brain. Lifestyle and home remedies: regardless of the cause of your sore throat, these at-home care strategies can help you ease your or your child's symptoms. Rest. Get plenty of sleep. Rest your voice, too. Fluids keep the throat moist and prevent dehydration. Avoid caffeine and alcohol, which can dehydrate you. Try comforting foods and beverage. Warm liquids, broth, caffeine-free tea or warm water with honey, and cold treats such as ice pops can soothe a sore throat. Gargle with salt water. A saltwater gargle of 1/4 to 1/2 teaspoon (1.25 to 2.50 milliliters) of table salt to 4 to 8 ounces (120 to 240 milliliters) of warm water can help soothe a sore throat. Children older than 6 and adults can gargle the solution and then spit it out. Humidify the air. Use a cool air humidifier to eliminate dry air that may further irritate a sore throat, being sure to clean the humidifier regularly so it doesn't grow mold or bacteria. Or sit for several minutes in a steamy bathroom. Consider lozenges or hard candy. Either can soothe a sore throat, but don't give them to children age 4 and younger because of choking risk. Avoid irritants. Keep your home free from cigarette smoke and cleaning products that can irritate the throat. Alternative medicine. Although a number of alternative treatments are commonly used to soothe a sore throat, evidence is limited about what works. If you or your child needs an antibiotic for a bacterial infection, don't rely on alternative treatments alone. Check with your doctor before using any herbal remedies, as they can interact with prescription medications and may not be safe for children, pregnant and breastfeeding women, and people with certain health conditions. Herbal or alternative products for a sore throat are often packaged as teas, sprays or lozenges. Common alternative remedies include slippery elm licorice root, marshmallow root. Thank you for watching. Please, if you have found immense value in this video, like, share and do not forget to subscribe to our channel to get notified on latest home remedies.